I'm Lisa Clute, the Executive Officer at First District Health Unit. I'd like to welcome you and thank you for tuning in to our COVID community status update. We have received a lot of phone calls recently, and we wanted to, and we are seeing a theme in questions that people are asking, and so we wanted to provide this opportunity to answer those questions that you may have. So, cases of COVID-19 within the 7 counties we serve, which again are Bottineau, Burke, McHenry, McLean, Renville, Sheridan, and Ward, have increased substantially throughout the past few weeks. The governor last week indicated new colors for our community. And those color recommendations or those color assignments are important because it provides new guidance to us as community members as to what we should do. So currently, Ward County, McLean, Bottineau, and McHenry are all indicated as orange counties. The recommendation on the Smart Restart guidelines indicates that that's 25% occupancy with a cap of 50 people. So we encourage strongly that businesses require face coverings. Restaurants and bars, we encourage them to do takeout, curbside, and delivery. We are recommended by the governor to limit individual family groups and sizes to 1 household or fewer than 10 people. Bar seating should not be there unless plexiglass is used and other physical barriers. Waiting areas in any facility should make sure that they are using social distancing. Gaming machines should be separated by solid barriers and so forth. The 3 counties in green are Renville, Burke, and Sheridan. Following the governor's recommendations, those counties should be looking at 75% occupancy with a cap of 200 people. There are the same recommendations for those counties that we continue to provide. That is maintaining the 6 feet social distancing, wearing face covers, utilizing electronic payments or contactless payments, providing plexiglass where physical separation isn't available, making sure that you are using good hand washing and so forth, using their restrooms, and follow all of the North Dakota Smart industry-specific protocols. All of those North Dakota Smart Restart guidelines are available to you on the North Dakota Department of Health website, and you can reference those. So the governor, when he does his color assignment, utilizes a 14-day rolling average for cases per 10,000 and a test positivity rate for the last 14 days. So with that, we monitor that daily, and we provide that information on our Facebook page, and I will just tell you where we're at right now. So our current active cases are Bottineau has 77, Burke has 25, McHenry has 61, McLean has 99, Renville 15, Sheridan 16, and Ward 1,222. Our active or our case rate per 10,000 for the rolling day average indicates us in a critical risk for all 7 counties. All are above that 200, or I'm sorry, above that 50 per 10,000. So we are watching that closely. The positivity rate, anything considered over 15% is considered a critical positivity rate. Currently, Bottineau is at 19.9%, Burke at 24%, McHenry at 19%, McLean at 15.1%, Renville at 7.2%, Sheraton at 14.2%, and Ward County 22.1%. Since our cases across the state have increased, the capacity to do contact tracing was not there to do it from what we were used to. So consequently, now if you are a positive case, you're contacted and you are asked to contact your close contacts. That's where our phone calls are coming in most from. Currently, we have dropped down an additional 5 lines at First District, and we have nursing staff and admin support answering those phones, and we are trying our best to respond to all of your phone calls. But our most frequently asked questions are, what do I do if I am a close contact? And so if you are identified as a close contact, you will receive information on the North Dakota Department of Health website as to what to do. Often people are asking, am I a close contact? They're not sure if they qualify as a close contact. All of that information is available there. First District Health Unit website, fdhu.org, has a link specifically to that, and you can find any of that information that you are requesting there. So if, again, you are identified as a positive case, a case manager will contact you and provide recommendations to assure that your family, friends, coworkers, and community members are not infected by you. So please follow those recommendations by the case manager and contact your close contacts and make them aware that they have been exposed or have been identified as a close contact. North Dakota currently is a hotspot, and we are a hotspot within North Dakota, so we need to do everything we can to reduce illness and death. We are working so hard and we are working so hard to keep these communities going. We want businesses to stay open. We want schools to stay open. And in order for that to happen, we believe that we need to reduce this community spread. So we receive a report every week from the White House. And currently that information that is provided to us from the White House gives a status update and recommendations from the White House as to where we're sitting and what we should do. So the report that we received on 10/25 indicated that North Dakota has the highest rate in the country for new cases and the 7th highest rate in the country for positivity. The report indicates that Minot is in a red category for the metro area, and the counties identified as such are Ward, McLean, and Bottineau. The White House provides several recommendations to the governor and to us, and those recommendations are reviewed. And right now I can just say in summary that they are recommending that prevention efforts intensify in our response. So what can we do? The same thing we have continued to share with you is that the key to this is slowing down the community spread. We have both Dr. Wigway here, Dr. Sather, and Randy Burkhart from Trinity. They will talk to you a little bit about the impacts that they are seeing in the patients that they are caring for, and the symptoms and the additional information that they are learning as this virus continues to spread. So we are asking you all to wear masks, but know that a mask is one tool to prevent this spread. When you wear a mask, you are preventing yourself, or you are preventing your neighbors from you releasing any viral load to them. So if you are positive or carrying an asymptomatic virus, the mask will prevent that from spreading. Now, it's important to wear good masks and to wear those masks appropriately so that they increase their effectiveness. And we will discuss that later on. So again, the best tool that you have is social distancing. If you're around people that choose not to mask, then continue to make sure that you are staying 6 feet away. That is a way to prevent yourself from receiving this. The hand washing, avoid large groups, will assist you in staying safe, and also when around others that choose not to mask and prevent the spread. So employers, it's really difficult. All of our workforces are being impacted, or most of us are, in some way or other, with positive cases or people needing to self-isolate. It's really important that people stay home when sick. If there was one thing that I could emphasize more than anything, it would be that right now. So please stay home if you are sick. Our priority continues to be to limit the spread of the virus while assuring that our businesses and schools can continue to function. We get it. We are tired of this. Everybody just wants to see normal. We all do. But we have an obligation as your local public health unit to continue to provide the information, to provide community status updates that are relative to the communities that you live in. And we want these communities to continue to thrive. So as we are seeing these numbers continue to increase, we are pleading with you to recommit to this new normal until a vaccine can become available. So with that, I would like to introduce Dr. Wigway. He is an infectious disease doc. He is the 1st District Health Unit health officer. He advises us. He reviews all of the materials as well as in research and provides us his guidance. So we are very, very fortunate to have somebody as skilled and dedicated and knowledgeable on this as Dr. Wigway. So with that, Dr. Wigway.
Good afternoon. My name is Dr. Wigwe. I'm here to address some of the questions that have been coming up that people may have about this disease. The goal is to keep everybody safe and so that we can return to normal, whatever that may be, or whenever that may be. Lisa has talked about, reviewed the data with you where we are. The situation is bad. There's no other way to put it milder. We take care of patients in the hospital who are sick with this disease, and the disease is not letting up. you may not, see it on a day-to-day basis, but people are getting sick and people are dying from the disease. One data that, they didn't mention is the number of deaths that we are seeing from this disease. People tend to be silent about it, but I can tell you that people are dying daily. I think the number from what county that I saw is 50 54 since the pandemic started. This is every person that dies from this disease is a preventable death. And the most unfortunate thing is the people that are dying from this disease are the most vulnerable among us. Many of them have not engaged in any high-risk behavior. They have not gone out and, sometimes there are people that are in the nursing home or in assisted living facility, and they have had the disease brought to them. And they have suffered the most devastating consequence of this infection. I tell people that it's not enough to say that, maybe I can recover from the disease, but each person that gets it puts pressure of the infection in the community so that it can spread even further and get to the most vulnerable and the most susceptible members of the population. So if we control it in one segment, we can control it in another segment. We cannot compartmentalize any segment and say, let's let it spread in one part of the community and let's try to control it elsewhere. It's not going to happen. We are all in it together. For those who are in nursing homes, in assisted living facilities, or even people who live in remote communities in the farm, they still have to interact with the other members of the society. Nobody lives in isolation. And if the disease is spreading in the community, it is going to get to everybody. So we are all in it to get anything that we can do, anything that I can do to prevent myself from getting it. It would also help me prevent my coworkers from getting it, or getting sick, or not being able to walk, or not being able to help us in taking care of other patients, or not being able to go out and provide for their family. The more people get sick, the more they are forced to take extraordinary measures, which in turn exposes other people to the disease. So whatever we can do, Lisa has outlined some of the things that are necessary to prevent this disease. I think we should take it more seriously. The more it spreads within the community, the harder it becomes to control it, and our desire to get back to normal is not going to happen as long as the disease is still spreading within the community and people are dying. So there are a few issues that, people have questions about. I see here antibodies. There's two ways of looking at the antibodies. Some of the antibodies are made by people who have recovered from the disease. So their plasma has antibodies. This is an age-old way of managing any new disease or any new infection. It's been tried for other disease. Sometimes it works very well. Sometimes it does not work. What I can tell you, when this pandemic started, there was a suggestion that maybe we can check people who have recovered from the disease. Once they have antibodies, we give them immunity passport. That means they can go about their normal business without any hindrance. But we now know that antibodies does not offer the full protection that we had expected that it would do. So just because you've recovered from it or you have antibodies to this disease doesn't mean that you're automatically immune. We don't know what level of antibodies that are protective. Not everybody has high levels of antibody when you check them in their blood. And we don't know how long the antibodies last in the blood. Some studies suggest that the antibodies disappear after anywhere from 2 to 4 months. So which means that if you were infected several months ago, there's a chance that you could get infected again, even if you have recovered. So the presence of antibody is not an immunity passport. And we have seen people who have been infected before and recovered get infected again. And there's a suggestion that when you have a mild disease the first time, when you get it again, that the disease tends to be more severe the second time when you get infected. Recently I read of a vaccine researcher in Russia that deliberately exposed himself to the virus, I think about 5 months after his first infection, just to see, just to prove that you can get reinfected. So it is possible to get reinfected. There's nothing that says that once you recover from it, you're automatically immune indefinitely. In terms of recovered, I know I mentioned something about people who have died. The death is the ultimate consequence of this infection. But there are people who, quote unquote, have recovered, but are still suffering the residual effect of this infection. Some of the people who are in the hospital spend months on ventilators. And even when they are not on the ventilator, they spend months on the hospital wards requiring oxygen. And when they go home, they still continue to struggle. And unfortunately, there is no known treatment for these people. We can just manage and support them. While in some people you can have this infection and completely recover and go back to your normal business, there are some people who get this disease who don't even have any pre-existing condition, and they continue to struggle, getting their life back to normal. So it's not something that I would recommend for anybody. My advice to people is the best treatment for this disease is not to get it. So the best treatment for COVID-19 is not to get infected. There are so many things that we are trying that we give people who are sick, but I can tell you that nothing beats not getting it. People ask about the treatment that was given to the president. I just want to address that because I know that that's some of the things that people think that, if you're sick and you go to the hospital and they give you the same thing that you'll turn around. The only thing I can tell you is that his treatment was initiated as soon as he was infected. And so it's easy to overcome the infection. When the treatment is initiated as soon as the infection is identified. Not many people get tested regularly. So by the time you find out that by the time you start having symptoms, many times the symptom starts as, some people think they have allergies. The only time people find out, suddenly they can't taste anything and they can't smell anything, then they begin to worry that maybe this is COVID-19. By then, sometimes people have had symptoms for 1 week, 2 weeks, and the infection has, progressed. So it's not possible to start you on treatment soon, very soon after you get infected. And, there's no way of guaranteeing that you can experience quick recovery once treatment is started, once you're hospitalized. Because the treatment is in limited supply, so we cannot treat everybody that tests positive. It's only those who are, sicker and get hospitalized qualify for treatment. So I can tell you that as members of the community, even as healthcare workers, we cannot expect to get the same treatment that the president got. And there's no place you can go and expect that there's any treatment that can be given to you that would guarantee speedy recovery. one thing is clear. There are some people who get infected and they recover from it quickly, even without any treatment. And we probably have heard about those people or know about those people. But unfortunately, that is not the case with everybody. And there is no way for us to predict who's going to die from it or who's going to fully recover from it. In fact, what we see is that there are some people, they get infected, and they get sick, and then they begin to feel better, and suddenly things things go so bad, and you try everything we can, and they still end up succumbing to the infection. That's a more common scenario. In fact, I've seen spouses where one person stays at home and the other person says, "Oh, you have all these multiple medical problems. You go to the hospital while I stay home. I can handle it." And the person that goes to the hospital first recovers. The person that stays home gets sick later and ends up dying from the infection. So there's no rule that says, I've seen people as young as less than 20 die from the disease. I've seen people in their 90s die from the disease. So there's no rule that says because you're old. And I've also seen people who are young recover from it. And I've seen 90-year-olds who recover from the disease. So let's not think that this is something that only people in their 80s or 90s should worry about. We all should worry about it. If for no other reason, so that we can decrease the force of spread of the infection, so that those other people that you think we should worry about don't eventually get it. Because, like I've been saying, if it is in the community, it's going to spread to everybody. It breaks my heart when I see people who live on a farm. They'll tell you they have not gone anywhere. They haven't, but they still get it. Well, even if you live on a farm, you still use the, you shop from the same store. People visit, family members come, even if you don't go anywhere, family members bring you things. They come into the house, and if your grandson or your nephew or your niece has it and comes to visit, they can pass it on to you. So as long as it's in the community, everybody is vulnerable, and we should do everything to decrease the spread in the community. Vaccine and herd immunity, I think, the WHO says that it's cruel for anybody to think that, to wait for herd immunity to protect, to be a way to get out of this infection. I think we should not do that. I don't know how else to put it. We have to be willing to sacrifice a large segment of the population to achieve that. And I would say, we don't want to do that. History will look back on, in 20 years' time and wonder, how did things get this bad? Because it will look back and say, why did we sacrifice all these people just for what for? So we can have a drink in a bar sooner than, because we don't want to wear a mask. I think, to me, it's unfathomable for anybody to say, let's just let the infection spread and, let's achieve herd immunity. For one, there will be a lot of sacrifice in the form of human, and there'll be a lot of human suffering and a lot of death in the community, more than we even want to acknowledge. And the other thing is, we don't even know what it will look like if there ever is herd immunity. Unless everybody gets it at the same time and recover from the same time. Because by the time the other people are getting it, the people who got it first, their immunity is already waning, and there's a new wave coming. I recall during the summer, we're saying that there's going to be another wave, and people, were saying now it is here upon us. So please, see, if anybody is telling you that, they are lying to you. They don't know what they are talking about. There is no way herd immunity is going to save us from this infection. That is fantasy, and that is foolish. In terms of vaccine, I'm hoping, I'm praying that eventually we'll get an effective vaccine. But I don't want to put my hope on that. Number one, I'll tell you why. I'm one of, like I said, the best treatment for this disease is not to get it. Not the vaccine. I'm not looking to vaccine to save us from anything. We are not sure that there's going to be an effective vaccine. This is, all the vaccine approaches that is being pursued now is something that we have not done before. So this is a brand new technology. It's going to require a lot of tweaking, a lot of trial and error to get it right. And even if we get it right, let me ask you, almost every year I always talk about people getting the flu shot. If we cannot convince people to wear the mask, how are we going to convince people to get vaccine? That we're not even sure how it's going to work or the long-term safety profile. I don't know. Because of that, I'm not. I'm one of those people that is not looking, and I don't know of anybody that is actually involved in this seriously that says vaccine is going to save us. I don't think so. We hope that there is an effective vaccine that that is discovered, but because of all the problems that I just mentioned, I don't think. But the worst thing that can happen under this scenario is where the first vaccine that gets approved, and then we discover there's a problem. And if later on, maybe after the third or fourth or the fifth vaccine that comes online becomes the one that is effective, people are going to remember the bad experience they had with the first vaccine that we had them take, and then nobody will take it. And then we're still back to where we are. So if there's one thing you can take away from me today is that the best treatment for this virus is not to get the virus. And if, Lisa has already talked about the things that we can do to prevent getting the virus. Wear your face mask, hand hygiene, social distancing, avoid large gathering, and look out for your neighbor as well as yourself. Thank you.
Thank you, Dr. Wigway, for that update. I'm Randy Schwann, Vice President at Trinity Health, and I've got a few things I wanted to go over and update the community on about the healthcare response. And Dr. Sather will wrap up with more points. But I wanted to point out that like other long-term care facilities and assisted living facilities, our own Trinity Homes has been dealing with outbreak in COVID-19 positivity over the past week or so. As you know, they've been going through 15, 16, 17 rounds of testing. Every week they're doing testing now. And this latest number of test results came back in that they have a number of residents and staff who tested positive. As of this morning, that number was 72 residents and 90 staff. So certainly is a situation that's causing a great deal of activity at the nursing home, trying to protect the residents and trying to also prevent further spread among staff. So admissions are currently on hold, and I guess I mention this because it speaks to the upward spiral that's going on in our community. This is a mirror of that spiral, and you've seen it in other living facilities and in the general community, as Lisa talked about earlier. So indoor visitation at Trinity Homes has been suspended as a result since early October, and that also has an impact on the residents and the staff and your family members at home. And All of our team understands that, and they're very supportive of trying to get communication to and from the resident, from the home, from their loved ones. But in order to protect them and the visitors, that has been curtailed, and they'll continue with electronic means of visitation in the short term. So thank you for your support in that. As Dr. Wigway said, every person who has symptoms or is asymptomatic, you're potentially spreading the virus to your contacts that you've been around in recent days. And those that they've been around in recent days are also subject to, as a close contact, becoming sick with this virus. And especially if you've been around groups of people, that propensity to spread among that group, whether you're sick or don't know that you're infected, is very real. There's only one way to stop that spread and spiral, and you know the drill. Dr. Wigway went through that eloquently about hand hygiene, face masks, social distancing, and avoiding large crowds. At the hospital, we hear a lot of questions and a lot of discussion lately around hospital capacity, so I wanted to address that briefly. There's really nothing new to report in hospital capacity. Yes, Trinity Hospital is at or near hospital capacity. We have been for weeks. We are similar to other hospitals in the state who are also at capacity. I think every day there's a count that goes out showing number of ICU beds and med-surg beds that are available in North Dakota hospitals. This morning, that number was low. It was under 20 total in the state. It listed Trinity Hospital with 1, and that goes up and down by the hour. So you take that number with a grain of salt. That's not a number that hospitals across the state pay attention to, although it is an indicator of the overall increase in hospitalizations in North Dakota. But one hospital to another, it does change by the hour and throughout the day as people are discharged and admitted and so on. So that ebb and flow of hospital discharges and admissions makes that an elusive and probably not highly valuable number for most of us. Just know that when we reach our capacity limit for hospitalizations, we do share that information with other hospitals who might be wanting to transfer patients to us. And during those peaks of hospital capacity, we can take in a patient who needs a higher level of care than they might be able to achieve at a smaller community. And we may stabilize that patient, and they may actually sit in our ER for some time before one of our ICU beds open. Or they may be sitting, waiting for a hospital bed to open up across the state. And so that kind of cooperation between hospitals happens all day, every day, and not only in COVID times, but certainly over the past number of weeks, it's been more consistent, more regular activity. We know of other hospitals who are at peak capacity, both in their ICU units as well as their emergency rooms, where they no longer can take in patients to the ER. We're not at that level yet, but so we know that we're all seeing this in our own community. As Lisa pointed out, the entire state is at a spiraling, record-breaking coronavirus impact. So we expect that to increase until and up to such time as we in North Dakota, we in Minot, us in Northwest North Dakota, change our behavior and really comply with these guidelines and take them seriously, knowing that our own personal sacrifice is going to help keep our neighbors and our families safer. We have a COVID call center and where people call requesting information or testing for being symptomatic. That COVID call center used to get 75, maybe 100 calls in a day, and that was a big day. This morning's report was we had 450 calls to that number yesterday. So our call volumes are way above what we can effectively deal with. We're trying to find more resources for that. You might experience longer delays when you try and call that number as a result, just giving you a heads up. Our daily capacity for swabbing at our drive-through clinic has increased to more than 150 a day. We're trying to find ways to increase it again because we are at capacity in our testing center as well. I believe the same is true at First District Health with their call volumes to their number as well as their testing. So again, if you want to get tested for COVID-19, you'll call for an appointment for that slot, either at First District if you're asymptomatic and need clearance for school, work, or whatever. And if you are symptomatic, you'd call Trinity Health COVID line and be expecting those numbers to impact our ability to get to you quickly. We have about 140 of our teams out on quarantine, and of course that many staff in any business has felt this effect as well across our community, across our state. It's harder to serve your customers, it's putting pressure on your other team, and we're certainly seeing that as well. We're pursuing lots of avenues to augment and relieve our staff who have been responding like the heroes they really are for 7 months. And they are also subject to potential for burnout. We recognize that. We know the community appreciates that. We do continue to see random acts of kindness among our own community here and across Northwest North Dakota as they reach out to our team and other facilities who are heavily impacted by this spread. And we just can't thank you enough for your kind thoughts, actions, and prayers. We're deeply appreciated. You'll be seeing in the next few days, perhaps before the week is out, at least sometime in the very near future, where Trinity Hospital will be tightening its visitor restrictions. And so when those restrictions are published, you'll be able to see them on our webpage and across different channels. The My Daily News is here. I'm sure they, among others, will help us publish what our visitor restrictions are. Again, it's an attempt by the organization to protect our patients and staff and others who may be in the facility. Finally, I just wanted to make a plea that hasn't gone unannounced already, and that is the flu shot. It's a time for the flu shot. We ask you to consider getting your flu shot now. It's more important this year than ever, we know that this is going to be a long, hard winter with flu and COVID hitting at the same time. So do what you can to limit susceptibility for the flu. It'll help you and everybody in the community. The higher level of intake that we have for that flu shot, the better. It's imperative that we do our part community-wide to reduce the spread of COVID-19. So those who wish to argue or ignore what's true in helping to reduce this spiraling threat doesn't change the truth. Stay away from gatherings of people. If you're planning to hold an event where safe distances can't or won't be maintained, consider modifying that. Help your community and consider changing your plans. Your plans for travel, you may need to look at that again. So we're appealing to the individuals of our community and our region to make small changes in your life that might have big, potentially life-threatening or life-changing impact on those around you, including your family and neighbors and friends. With that, I'll pass it off to Dr. Sather, our Chief of Medical Staff.
Thanks, Randy. I'm Dr. Jeffrey Sather. I'm going to avoid statistics and just kind of speak to you as the rural North Dakota kid I am, and having been born in this community and spent most of my life here and living out on the farm and taking care of my animals and as a North Dakotan. So I don't really know how we've gotten where we are as a society, where we've taken a public health crisis and turned it into a political issue. Reality is that COVID will take and become the third leading cause of death this year across our country. we as a society should be united in trying to fight the battle of this disease. And we're in a time, though, where our compassion has seemed to give way to the social media vogue theme of picking a side. And then everybody becomes an expert in the subject, no matter how uninformed their opinion really is. So with that, maybe the politics can go away after today, being election day. And we can look at this with some humanity and concern from each other from this day forward. We North Dakotans are in crisis. Last night at our hospital, we had no more room to admit patients. We had patients stacking up in our ER. The normal process is we call around to the larger hospitals that have the same capabilities and ask them to accept our patients. We found no other hospital could take and care for our patients. That means those patients stack up and remain in our ER. And then they have to wait until a bed opens up, either at our hospital or in another hospital. And in that time, they stay in our ER. That's regardless of whether your disease is COVID or something else. Remember, there's more than one disease. We're talking about COVID over and over again. We still have people that have heart problems, which is the #1 killer, and cancers, which is the #2 killer, and now COVID, which has become the #3 killer ahead of trauma and accidental injury. Being at capacity is a reality, not just here in Minot, but across the state. That reality is not evident to most people. The general population doesn't realize the struggles that health systems are going through. Unless you or your family is one of those patients getting transferred across the state 300 or more miles, or laying on an ER gurney rather than a hospital bed for 24 hours or more. And that's happening. That's reality right now in North Dakota. Behind the scenes and away from the camera, we have many heroes. We have countless medical staff, including medical support people, that have the weight of the world on their shoulders right now. This is a horrible disease. As it comes on, patients can be infectious before they even know they have the disease. And they spread the disease because of that without taking precautions. Many have mild disease and get better very quickly. There are many others that get sick, and some get very sick. Sometimes the disease gets better over a few days, but a week or two later, it resurges. And those patients become very, very sick and hypoxic. Hypoxic means you're not getting enough oxygen. Some patients have long hospital stays, and many have died a horrible disease. This is witnessed by our healthcare workers every hour of every day right now in our state. When I go out and ask my colleagues, and I round in the hospital and talk to healthcare workers about what's going on, and specifically ask them what their worries are, I feel nothing more than very disturbed. When I ask them to talk about what they fear the most, of course, they talk about their fears for the patients. But when I get them alone and listen to what they are really worried about, they worry about the mental health of their coworkers. They worry about the mental health of their colleagues, and they worry about their own mental health in dealing with this. What I've heard multiple people say, unsolicited, when I get them in a private conversation is, I have to watch someone suffocate to death every day, and sometimes several times a day. The toll of this disease is not known by the public. Being at capacity is not as much about space as about staff. There's no cavalry coming to save us. We have to slow the disease by the only method we have possible. And that method is to take some of the simple steps that have already been discussed to decrease the wave and spread of this disease, to decrease the influx of patients that we're getting at all of our healthcare systems. How does something that's such a killer become so controversial? The ask is simple: a little common sense and respect for each other. So I want to touch on the simple things we can do. Most of them have been talked about. First of all, I want to touch on underlying conditions. I don't think anyone talked about that yet. I don't know where everybody's at, but look around the room and look in the mirror. 60% of us have underlying conditions. It's not a small, select few. And many of us have more than one of those underlying conditions. Limit the crowds you're in. It's not a big thing to ask. It will protect you and it will protect other people. Limit the time you spend in public places. The less contact, the less chance you have of getting the disease. If you have the disease, please stay at home and isolate. This is for everyone else, not you. Wash your hands frequently. Don't touch your face unless you've washed your hands prior, and wash again after. Frequently disinfect surfaces. And masks, they've become so controversial. Nothing's 100%. Some are better than others. It's pretty common knowledge that the proven effective mask is the N95. But even a simple cloth mask can prevent a slight cough from putting droplets in the air and minimizes the viral load available. Please show some respect and wear a mask in public. No one knows the long-term effects of this disease. I wish my crystal ball worked. We don't know what's going to happen down the road to those that have had this disease or those that might get the disease. So limiting the spread and minimizing those of us that have it's the only way to protect people. There's a lot of remedies out there over the counter, and some have some hint that they might be beneficial and others might not. And so if you want to use them, please do. Things like vitamin D and zinc are used by a lot of people, but my caution as a physician would be follow the label. Don't overdose yourself on something because you think it's safe. Even the simplest things have a level where they become dangerous. So use common sense in those areas. All of this is common sense. Last thing I want to put out as a message, manage your stress. I feel it every day. So do my colleagues. So do all of you. Some 5 basic things that you can do. Adequate sleep is essential. Proper nutrition is essential. Some form of daily exercise is essential. Manage your interior life or peacefulness, whatever that is for you, do it. And then the last thing, avoid excessive substance use. So that's all I have to say, so I'm available for questions.
Thank you to Randy, Dr. Wigway, and Dr. Sather. I also have to just say I admire every day the healthcare workers and the heroes that are working throughout our community. It warms my heart. It also has been so encouraging to see increased, the mask is a visible thing. So we see mask usage and non-mask usage. We've seen increased mask usage, and that is great. We know that a large portion of this community is working hard to prevent the spread. But what we wanted to do is just take this opportunity to tell you exactly what's happening in our community, your community, and we want to cheer you on to practice. It's hard. We get it. We're all tired. We don't like this at all. We do not want to see anything closed. We don't want to see anything reduced and impacts into our lives. So we believe that these simple mitigation strategies can assure that you can continue to go to your favorite businesses, support them, and schools can continue to educate the high-quality education that we have enjoyed so much. The other thing is testing. Testing, as we've seen increased cases, the demand for testing has increased also. Currently, we are at capacity right now, what we are allowed by the state for testing. We go each week and determine how many tests we have available. We have a static site at First District. So in other words, we test every day from 8 to 2:30. We are swabbing probably 120, 130 today, or per day. Please call and make an appointment. That assures that we don't have full waiting rooms and we can get you in and out efficiently. Currently, to get into that is about a day, sometimes more, sometimes less. So just call our numbers. As I said earlier, we've increased our phone capabilities, and we will get back to you as quickly as I can. So that is available at First District. All of our county offices have some test kits available. Contact them if you need tests. Again, we are testing the asymptomatic people or close contacts. We do provide testing at MSU twice a week and at Bottineau once a week right now. And those colleges are open to the public also. So look on our website, look on our Facebook page, you'll see when testing is available. We did a testing event today at MSU, and we were not able to accommodate everybody that was in line today, which is the first time that's happened. So we know the demand is increasing, and we are working at increasing capacity to respond to that demand. So with that, it's an important day in our country. It's Election Day, and I encourage all of you to practice your civic responsibility and duty and cast that vote if you have not done that already. So we love our communities. We love our families. And we are doing everything we can to assure that our communities and our livelihoods stay healthy. So please help us out. We will continue to provide you the information that we think is relevant to your communities, and feel free to contact us. So with that, I stand for any questions. Jill? Perfect.
About a lack of beds at Trinity and across the state. At one time, they were standing up beds, and Bismarck College stood up beds. Is there a chance to go back to that? Would that be helpful?
So the question is, in the past, they talked about standing up beds at alternate locations. And so that's a great question. I want to circle back to the answer, because the reality is it's not physical bricks and mortar beds that is causing us to be in crisis. It's the ability to have staffed beds. And as these numbers continue, without more staff to take care of patients, which there is no magic wand to wave to get staff, because this is an across the country crisis. The only change that can happen is to start stretching staff that we have. And knock on wood, we don't ever want to get to the point that we have to start changing standards of care. But if numbers skyrocket, which they're going up very sharply now, as everyone knows in our areas, as you see the numbers, overall numbers go up, remember a percentage of those patients are landing in our hospitals across the state. And some of them are very sick and requiring high levels of care. So it's not about a physical bed to lay a patient in. It's about staff to care for the patient at the level they need to meet the medical standards that we all expect to have. So, it's not physical beds.
About the immunity wearing off in 3 or 4 months in many cases. What does that say for the effectiveness of a vaccine? Is there some concern that a vaccine effectiveness will wear off as well in 3 or 4 months, or we need to have a vaccine maybe more than once a year?
You know, that is the thinking of some people right now. In fact, I had mentioned to you that, a Russian virologist that deliberately exposed himself to the virus to see if he can get infected. That was his conclusion that if a vaccine is eventually found that, we'll need to revaccinate people after several months. How often, we don't know right now. Again, the vaccine question is still, we don't know what vaccine is eventually going to be found to be effective, and whether there are some vaccines trial that are one time, and some, in 4 weeks you have to give 2 doses 4 weeks apart. Whether that will provide better protection than the antibody that we're seeing with infection, we don't know, but that's a possibility, and there are some people that are thinking that if eventually an effective vaccine is found, that we may have to take multiple shots to get protected.
How about for the elderly who have the weaker immune system to start with, people in the nursing homes? Is there a concern about how well the vaccine may work with them?
That data we don't know yet, but the vaccines that are in trial, based on the available information publicly, is as effective in the elderly population as it is in the young. Okay, thank you.
Do you have a count of the number of COVID patients in your hospital? We're hearing some numbers that.
Need a microphone, nobody can hear anything.
What is the number of COVID patients? Most of the patients were there because of COVID, or they tested because of the
Great. So this is Randy again. The question from Joe was, do we know, could we say what the number of COVID positive patients are that are hospitalized today? As inpatients at Trinity Hospital because of COVID, or that they are hospitalized for some other reason but are COVID positive as well? Dr. Sather, I'm going to look to you for the number. This morning it was about 32 or 40, wasn't it? So we're at 40 or above, just over 40, might be 42 by 43 by now, but of those patients who are inpatient with COVID-19 positive. Those are being treated for COVID-19. So that includes our ICU, which is has been about a half a dozen or a few more, and others who are on our nursing floor with COVID. Yep.
Does that include the people who might have come for some other reason and they tested them?
That would include, because they would also be on the same floor, and maybe not because of COVID, but with COVID. They might have been for surgery for some condition and had been a positive, COVID positive patient, and will be discharged. But that's a small number compared to the overall 40 people. Most of them are inpatient in a critical care or acute care bed because of COVID treatments that are necessary. I'll let Dr. Sather talk to that.
I'm just wondering the percentage of your patients now, how many of them are COVID?
So it depends on how you want to count patients, right? Because our overall census right now is probably 130-ish. I didn't see the sheet this morning, 140-ish in that range, overall census, and that includes all hospitalized. But if you break it down like medical surgical, it's reaching virtually fully half of our patients on some days of that group that's COVID positive. And as Randy said, the percentage that are there that may be tested positive for COVID but are there for something else is tiny. Majority of COVID patients are there with COVID symptoms. And those numbers are the hospitalized numbers. That doesn't include the probably, depending on the day, the 10 to 20 to more patients that are actually seen, evaluated, and are stable enough to be discharged. And so that number is rising greatly as well. Every day, patients are being admitted and discharged and dying because of COVID every day. You know, we see in our ER every day is highly variable, 80, 90 patients is not an atypical day in the ER, and 20 of those at the present time might be COVID. The interesting number is that's a typical ER volume for us, even pre-COVID. So what that tells me is we're seeing a decreased number of other things when that high a percentage are coming because of COVID. And so the worry long-term, which we've already seen from way back in early this year, there are a lot of ignored illnesses out there that are happening. And maybe some things are being decreased if people aren't out and are around as much as usual. Trauma numbers could be decreasing a bit, but our trauma numbers have held fairly high. So the worry is there's a lot of ignored illness going on because of COVID as well.
So I want to thank you all for tuning in. I want to encourage you to practice good, healthy behaviors so that you can continue to be well and fight off this virus if you come in contact with it. So with that, thank you so much. Please vote and have a good rest of the day. And we will continue to provide updates as needed. Thank you.